So to start right off the bat with happening here and happening now, I just wanted to put up a sort of overview slide with a representative map of different observed climate changes that are particularly relevant to human health. And of course, this doesn't capture all of them, but I think it's important to note that, you know, we see increasing storms in the east and hurricanes, increasing storms in the north and hurricanes in the east and heat waves and wildfires in the west. And we see increasing flooding in the north and sea level rise around our coasts and islands. I mean, this are impacts that are happening all over. I don't want to go too far into these because I'm hopeful that in previous learning sessions you've had a little bit more on the science behind climate change. I just wanted to point out, because it'll be a pretty central theme of what I'm talking about here, that these are impacts that are already occurring here in the U.S. and affecting everyone. Next slide, please. So most of my talk is going to be based off of this scientific assessment that came out last year, the U.S. Climate Change and Health Assessment. And this is a product of the U.S. Global Change Research Program. If you're not familiar with that group, it's a federation of 13 different federal agencies that work on climate change. And they are congressionally mandated every 4 years to put out a big national climate assessment that looks at all of the impacts of climate change to the U.S. And so the last assessment was in 2014, the third one. The fourth one will be in the very end of 2018. And so you get these giant reports that come out every 4 years. There's something like 800 pages long that assess the impacts of climate change across a whole range of sectors and regions. And even though it's, you know, a huge 800-page document, when you are talking about all the different impacts of climate change, you know, the chapter on health ends up being something like 10 pages long. And as such an important topic and with so much information here, we felt we really wanted to pull the topic of impacts on health into its own assessment. And so we just finalized that last year, so a full report just on impacts of health. And so this report breaks down impacts into extreme temperatures, both heat and cold, air quality, extreme events, vector, water, foodborne diseases, and mental health and well-being, as well as looking very closely across all these chapters and in a chapter of its own on different populations of concern. And so, of course, you know, when you're developing a report like this, you have to have chapters and sections, and so you have to silo these different topics into their own chapters, but of course, that's not actually how most people experience these health threats. A lot of these threats can be compounding, cascading, or cumulative, meaning they can happen at the same time. You can have a hot day and bad air quality and be outside and subject to Lyme disease. They can be cascading in that they happen one on top of the other, or that they cause different health threats one after another. And of course, they can accumulate over the course of one's lifetime. So I'm going to be walking through each of these bullet points through this talk as if they're, you know, individual topics, but I just wanted you to keep that in mind, that just because we silo it into chapters, that's of course not what it's like in the real world. Next slide, please. So I'm going to start off talking about extreme temperatures, and maybe you've seen this slide already in your previous lectures. This is a figure from the third National Climate Assessment that came out in 2014, and it's looking at observed U.S. temperature change. It's specifically looking at the temperature change of the last 22 years from when this was developed, so between 1991 and 2012. And it's comparing that to the 1901 to 1960 average. And so you can see how across the country, we've already observed a lot of increases in temperature change. If you look at the bar graphs for each of the regions, those are broken down into decades. And you can see that the 2001 to 2012 decade was warmer than any previous decade for every single region in the U.S. Next slide, please. So when we think about rising temperatures, often heat is what we think of, or sorry, when we think of impacts of climate change, heat is what we think of first, and it comes very quickly to mind. If anyone's sitting where I am in Washington, D.C., it's hard to not notice how hot it is outside. And it's also often what first comes to mind in terms of acute symptoms from climate-related health impacts. So we think about these spectrum of very acute outcomes ranging from heat cramps through heat exhaustion through heat stroke. And of course, these can affect people very differently. People who have occupations that take them outside, like agricultural workers or construction workers. People who are playing sports outside are exposed to this much more than others. Certain people, like children or the elderly, have biological dispositions that make them more sensitive to extreme heat. And it's important to note, too, that a lot of heat-related illness can also occur and does actually occur indoors, especially for people who don't have or can't use or don't use their air conditioning, low-income communities. And so this is, of course, something that comes to mind pretty quickly, but I wanted to point out at the bottom of this slide, too, that one of the main findings of our climate and health assessment was noting that climate change can exacerbate existing health threats and create new ones. And I'll talk about those new ones a little bit later on, but this is one of those instances where heat can really exacerbate a lot of pre-existing conditions, including respiratory illnesses, cardiovascular disease, kidney diseases. And so in addition to thinking about just going outside or being inside and being very hot on a specific day or during a specific heat wave, just remember that this also has a very big impact on exacerbating the health threats we already have here in the U.S. Next slide, please. So these, there's 4 key findings from the chapter on extreme temperature, which, as I noted, I think looked at both extreme heat and extreme cold. I'll talk about this first one a little bit more, which is looking at the future increases in temperature-related deaths. So the graph that you're looking at is 2 different models projecting changes in deaths in the U.S., in cities within the U.S., and looking at both extreme heat and extreme cold. And so as temperatures are rising, we expect to see an increase in heat-related deaths. We also expect to see a decrease in cold-related deaths, but it's important to note that the increase in heat-related deaths far outweighs that decrease in cold-related deaths that we expect, such that we are projecting an increase of thousands to tens of thousands of premature heat-related deaths every year by the end of the century. And I'll just wanted to call out that second bullet point there, too, that days that are hotter than usual in the summer or colder than usual in the summer are, of course, associated with increased illness and death. But we also see a lot of mortality or sickness effects even when there are small differences in seasonal average temperature. And, of course, those small temperature differences happen a lot more frequently than the super extreme large temperature differences. And so this is an impact that we expect to actually face a lot more often than the extreme heat or the extreme cold.